In this short video, you'll learn all about supporting colleagues that are returning to work after sickness absence. Let's dive straight in with a case study. You manage a small team of 3. One of your direct reports has just returned after 2 weeks off sick. Their fit note simply says, stress. They're back now. They say they're fine. So that's the end of it, right? Hopefully, but we do need to take a closer look. We need to ask ourselves, what caused this episode of sickness absence? And could it happen again? Firstly, the individual was so unwell that they were unable to work for 2 whole weeks. Secondly, the reason for sickness absence, stress, is such a broad term. It could describe a one-off issue that has now resolved, or it could describe something much more pervasive. Even with just this headline information, it's clear that there could be a lot more going on, things that could affect the person's health and their productivity again in the future. Let's look at 3 very different scenarios, all equally plausible within this case. Scenario A. The employee is usually well. They were suddenly evicted from their home and spent 2 extremely stressful weeks finding somewhere new to live. But now the issue has been resolved and they are feeling back to baseline. Scenario B. The stressor is actually work-related. A colleague has left the team, workloads have increased, and this employee feels unable to keep up. Their anxiety is starting to build. Scenario C. The employee has an underlying anxiety disorder. The eviction and the increased workload have compounded things. Their sleep has deteriorated, their concentration has deteriorated. They needed the sickness absence as they needed to take time off, but worried about job security, they have started using alcohol to cope. So we have 3 very different scenarios within the same initial information. Each scenario has a completely different implication for capacity, risk, and support needs. Scenario A likely represents a resolved, one-off issue, but scenarios B and C highlight deeper, ongoing concerns that could easily recur or escalate. So how do you know what you're dealing with? This is where it gets tricky. Employees may not want to share personal details with their workplace. Managers often aren't sure what they can ask or what to do with the information if it's offered. And without a clinical perspective, it's hard to interpret health information or spot when a temporary issue is becoming a longer-term problem. This is where occupational health can make a difference. Occupational health provides a confidential clinical assessment from somebody who understands both health and the workplace. With the employee's consent, occupational health can share clear recommendations to support a safe and sustainable return to work. Ideally, everybody returning from sickness absence would have a short occupational health check-in. But many workplaces do not have this routinely, so managers need a structured way to gather information themselves. Here are some factors that can be helpful to look at when somebody returns from sickness absence. Firstly, absence pattern. Asking questions like, how long were they off? Do they have any previous absences? Are there any underlying health conditions that you are aware of? Secondly, using the information on the fit note. What reason was given for the sickness absence? Did the fit note share any suggestions for adjustments? Also, it's important to think about possible work-related factors. Has workload or workplace stress been an issue in the past? Could it have been contributing in this case? Thinking about the employee's own perspective is really important. What are they willing to share about how they're doing now? And do they feel genuinely ready to return? Finally, spend some time thinking about non-health stressors. Life events can heavily influence work capacity, and it's important that we don't discount them, because life events can impact health too. By gathering information in these areas, managers can better distinguish between a resolved one-off issue and something that may require more support or a referral to occupational health. So, to summarise, whenever supporting colleagues returning to work, remember to think carefully about the reason for the underlying sickness absence and whether it has been addressed. And remember, a return to work isn't a single moment. It is a process, so keep the conversation open, check in over the first few weeks, and monitor how the employee settles back into work. This helps you spot early on whether they're settling back in okay, or whether occupational health support could prevent further issues down the line.